Welcome back to another podcast of Heal Without Harm, and my name is Dr. Clayton Dir, physical therapist, also known as the Doc Dir. Today's topic is going to be shoulder pain. It'll be a solo episode. It'll just be me giving you the 411 on shoulder pain, what to do about it, who to go see for it, and providing a little bit more context on what to say or what to ask of the provider that you choose to go to. Some topics that we will cover is whether or not you need an x-ray, whether or not you need an MRI, what questions to ask those providers, what type of tears you may or may not have, whether or not those tears need surgery, some different things like chiropractic care, different types of physical therapy, massage therapy, injections, all of those things that sometimes, unfortunately, are just pain relievers, but they are not problem solvers. I do want to remind you that this is not medical advice. This is me providing general information based off my practice along with research studies. And I want to make you a little bit more educated so that when you do go and get evaluated, you can self-advocate a little bit better and ask really good questions and sometimes challenging questions to that provider to make sure that you're getting the best service, the best evaluation, and the best advice on what to do moving forward. The majority of clients that I see do not have rotator cuff tears. I'm going to just start with that. And if they do have some sort of rotator cuff tear, most of the time it is a degenerative tear. That is a fancy way of saying that you have used your shoulder, or sometimes you don't use your shoulder and that's the reason you're having the pain. But it is a tear that can be easily rehabbed, strengthened, and then make all the pain go away and get you back to doing what you want to do and ultimately not need surgery. If you're listening to this podcast, you probably don't want surgery and you are looking for answers on how to avoid it. If that is you, continue listening and I will help provide some steps moving forward to get you in front of a provider that shares those goals. That is most likely going to be a physical therapist. And if you need help with that, please reach out on the link in my show notes so we can talk more one-on-one on finding someone in your area. Moving on. If you're over 40, you use your shoulders, you probably have some sort of degeneration, honestly, anywhere in your body, but specifically shoulders, because we're talking about shoulders right now. That is not of much concern at all. The thing is are you doing what is necessary to keep those muscles and tendons strong within the shoulder so that they can last as long as you want them to and allow you to keep doing what you want to do with them? If you're running into barriers and you can't do what you want or you're having pain, you need to get properly evaluated. Most of the time, and I talked about this in my low back pain podcast, you will go to a medical doctor and they will x-ray it to rule out fracture, even though we know that's not the case. X-rays can sometimes show arthritis, but generally not super duper good. And then they will prescribe you pharmaceutical medication like meloxicam or some sort of anti-inflammatory, potentially a muscle relaxer, and then they will generally refer you on to either a PT or an ortho. I'm happy that more doctors now are referring you on to a physical therapist because they're the ones most specialized in giving you a good clinical evaluation. If you don't want to do those things, in Kansas at least, you can go directly to a physical therapist. We call it direct access, and that allows you to get properly evaluated and save you time and money from going to the medical doctor first. A massive benefit. If the physical therapist thinks that this is not something they can help you with, they can immediately send you right back to the doctor or onto urgent care ER, whatever it may be. We are well educated in that, and we know when to send on and not treat you if we're not the person for you. This one surgeon here locally in Wichita has said at different conferences that he will speak on, he'll say, if you want to do surgery on the shoulder, take an MRI, especially on an older individual, because you will likely find something wrong and make them a candidate for surgery. So if you don't want to get surgery, do your best to stay out of an ortho's office at the very beginning, and you are less likely to get surgery. Moving on. The way the shoulder works, you have 4 or 5 muscles that provide strength and stability and movement on the front, the back, the top, and the bottom of the shoulder socket. I want to keep this super simple. If those muscles are not strong as they need to be for the movements that you want to do, they will likely start having pain. If we want to put this in a big umbrella term, we can call that tendonitis. That's not the most accurate term, but we can call it tendonitis to keep things relatively simple and speak a similar language throughout the rest of this podcast. Most of the time, that tendonitis will get started or some sort of inflammation will get started. I don't want you to picture like there's this local little fire inside the shoulder necessarily, but you will have this, what I call like an invisible ceiling or like a capacity where if you do more than what your shoulder can handle, pain comes on. Usually people take two different routes at this point. You start having shoulder pain and you can either go, well, I'll stop doing all the activities that hurt it, or you can go get evaluated and start solving the problem or solving the reason that you're having that pain, and you can get back to doing the activities you like. Unfortunately, I see a lot of people, they just simply cut out all the painful activities. They stop reaching overhead. They stop putting their shirt on that old way that was much easier. They stop doing their hair the same way. They stop putting stuff on top shelves. They just avoid all those activities. Well, unfortunately, if you keep doing that, the shoulder will actually continue to worsen. You will start doing less and less activities. You'll ask for more and more help. The shoulder will get weaker and weaker, and you'll get less and less range of motion. Most of the time, people don't want to go that route. They want a more long-term fix. So, coming back to the shoulder and the muscles and how to think about this, if you don't do anything to address the pain will stick around. The other thing that I usually see people do when it comes to shoulder pain is they will go in search of just simply pain relief, not problem solving. The reason chiropractors can often help, and I'm speaking generically here. So if you go to a chiropractor and all they do is pop your back, that can help because the quick stretch that delivers that usual crack sound or that pop sound is really good at treating the nervous system and telling the nervous system to decrease muscle spasm and decrease pain. But as you probably already know, it's short term. It's for a matter of hours or days, and then the pain comes back. Again, Band-Aid and pain reliever, not problem solver. Another thing that people often do, they'll go get a massage. A massage operates with the same goal in mind, but on a different modality. Instead of popping the back or the shoulder, they massage the muscles. So they will sit there and rub a certain muscle, or maybe they'll do a sustained hold or some sort of myofascial release, and they'll get muscles to relatively calm down. But again, at the root of this, if you only take one message away, the pain that you're having is most likely due to a relative weakness to the activities you want to do. So if you just go get a massage, go get popped, pain goes down, but it'll come right back if you don't address the root cause, most likely muscle weakness. Moving on. The other thing that people will do is they will go to a medical doctor, their general PCP, primary care physician. When they go there, like we already talked about, they're generally prescribed some sort of pain reliever. If that doesn't work or they don't want to take pills, they'll often be offered a cortisone injection. More studies are coming out that doctors are not educating the patients enough on the potential and actually somewhat likely side effects that will come from that corticosteroid injection, or maybe it's just steroid injection. I may be speaking incorrectly there. I apologize. But that injection can oftentimes, or at least sometimes, cause breakdown of soft tissue in the area. So it's almost like you're borrowing time from future self. You are getting pain relief now, but actually speeding up that tendonitis-like thing in future, leaving you more likely to get a surgery, more likely to get a joint replacement. Athletes and club teams, load up your gear with Van Gogh Transport Services. Led by local Ironman triathletes, Van Gogh safely ships your bikes, team equipment, or even bulky luggage to out-of-town events. Focus on performance, not logistics. Explore more at vangohtransport.biz. It can also lead to avascular necrosis, which is a fancy way of saying low blood flow leads to bone death or tissue death. I've actually even seen something like this. We call it atrophy, which is a breakdown or shrinking of tissues. I had a patient who had an injection in her knee, and then within weeks, months afterwards, you actually notice there is this almost concavity, this like divot in her knee, what used to be soft tissue there, and it was very abnormal. And when she went and got, I think it was like her third or fourth opinion on that, he said, actually, that can be a side effect of injections, and that can be just the breakdown of tissue there, which led her to have chronic pain secondary to it. So yeah, she may have had pain relief from that injection, but it led to chronic pain. It led to more pain in the future that is actually harder to get rid of. Again, side effects that are likely enough to happen, because I've seen it numerous times, and in the literature, it's happening at a higher rate because people are getting more and more injections. Something to steer clear of. Continuing on, let's go on to the different type of rotator cuff tears. You can have traumatic tears. This is traditionally the people who fall and land on their arm and they feel it tear. I had one guy who was bench pressing a ton of weight, felt it tear. They reached overhead really quick. They reached out and someone hit their arm. Something happened and then instantly they had pain. Those are probably more likely to get surgery or need it because this thing tore and they have to go put it back together. If that's you, I would say yes, maybe get evaluated by a PT, but we're probably going to quickly refer you on to an ortho to double check and see how bad the tear is, if there's a tear. The majority of you that are listening now are probably going to fall into that, either one, just tendonitis, or two, that degenerative tear. Man, that is really hard to say today. If that is you, we know when to refer you on, but you most likely don't need it, and you will respond significantly well to strengthening, because the body, when going through the process of strengthening a tissue, will actually start to build up and repair that tear itself. You don't need surgery and all the potential side effects that come with that, of going under anesthesia, of coming out of anesthesia, of potential infection, just because every time we cut you open, we know that there's an increased chance of infection in general, and there's some others as well, but those are generally the main ones. The last thing I want to talk about when it comes to this is, not only will PT and progressive strengthening and overload be tremendously helpful for shoulder pain, but chronic shoulder pain is going to be quite responsive, because let me paint a picture for you. If you consistently don't use a muscle, what'll take place, and this is where it leads to that degenerative tear, what'll take place is this nice red beefy muscle tissue will slowly start to break down and kind of wither away. And what will happen secondary to that is fat will start to infiltrate it. So what this looks like on an MRI, or if I could create a more tangible visual, is instead of a nice sirloin steak that has no fat in it, so picture it, like packaged up in the grocery store, that sirloin steak has no fat in it much at all. But if you think of a ribeye, you see this marbling. You see this fat integrated within the fibers of the muscle. When using a muscle less than you used to over a long period of time, and your body's like, well, heck, if we're not going to use this, let's get rid of it, or let's start not paying attention to it, fat will start to infiltrate that muscle. And so it's going to be weaker and weaker and weaker. So if you have pain for a long period of time within shoulder musculature, this can be similar, or the case for other muscles as well. But if you don't use that and fat starts to infiltrate it, you're going to have not only pain and weakness, but you're going to have a harder time getting that back. It's going to take longer to strengthen that muscle and start pushing that fat out. However, another big message I want to leave you with is, this is reversible. You can change this. You just need to be patient and disciplined enough to keep showing up and keep doing the movements, and your body will take care of it. Your body does a fantastic job of healing its own tissues when it's signaled correctly and you have repetitive things taking place. So you show up to the gym 3, 4, 5 times a week, and you keep doing the recommended exercises to strengthen those tissues, to push out that fat, to turn the ribeye steak back into the sirloin steak, to get robust musculature and decreased pain. To finish out, I do want to let you know that on all of this, I will leave 2 or 3 exercises down in the show notes just to get you started. I'm not saying they're perfect for you, because again, you probably need proper evaluation to get down to your problems. We need to find your weaknesses, your mobility deficits, and get stuff personalized to you. But if you want to just look at 2 or 3 starter exercises, I will have those down in the show notes. Some takeaways from today, because I know I bounced around quite a bit. You can go for pain relief, but it's probably only going to be temporary, and you need someone to help solve the problem. I'm sure you want long-term solutions, so let's do long-term solutions. Let's get down to the root cause. Let's get proper evaluation. Let's give you a game plan to start strengthening your weaknesses and increasing your mobility deficits. Well, improving your mobility deficits. Let me be clear here. Chiropractic care, massage, and sometimes even injections can be quite helpful at the start, because sometimes your pain is quite high and you need some sort of relief at the beginning. But if you don't follow through and carry through with consistent strengthening and whatever muscles are weak, then you're just going to keep banging your head against the wall. You're going to get pain relief, pain comes back, pain relief, pain comes back, pain relief, pain comes back. And I think at the end of the day, whether we want to admit it to ourselves or not, that is not what we want. That is not what you want, and that is not what I want for you. To finish out today, like I said, exercises will be down below. I hope this was helpful for you. If you have further questions on this, please contact me on Instagram, TikTok, or one of those 2, or the link in the bio, and I would love to get more specific and do some sort of Q&A if needed. I also ask you so much if you could please leave us a rating and or a review, whether it be on Spotify or Apple Podcasts. I'm actually quite surprised. We already have over 10 on Apple Podcasts, and we're working our way there on Spotify. So for those who have done it, Thank you, thank you, thank you. We only have one actual review with written words. That brought me so much joy when I saw it. So although I do appreciate the 5 stars more than you know, I love seeing these little things at the end saying how helpful this is for you. So please leave a rating and review. And then I do want to say, if you share this to your story and you tag me at the Doc Dir on Instagram, I will absolutely share it. And I will even throw some words down of appreciation so that when you share it and then I share yours, you can hopefully get a little bit of exposure as well. Thank you all for listening for today. I hope this helps you or the friend or family member that you sent it to. And hopefully you learned a little bit more today about how to heal without harm. Thank you so much.